there are two main reasons why we would want to have a more personalized approach in the treatment of MS. The one that we focus on in this work that I'm presenting at the AAN pertains to the use case in the clinical trial setting. So in the clinical trials that we've had in the past in the progressive forms of MS, there's been it's been a difficult process to try to identify drugs that actually work at slowing disability progression effectively. And one of the challenges is that the outcome that we're measuring, disability progression, changes very slowly over time. And so you would need a very large population or a very long trial to ensure that you could detect even the smallest of effects. And so having a more personalized approach in this setting means that we can use something called predictive enrichment, where we can predict which individuals will benefit most from the treatment that the study will test, and preferentially randomize those individuals into the clinical trial. And by doing that, the expected effect size of the clinical trial increases, and the power of that trial to detect a significant effect increases. And so the idea here is that whereby if we randomize every participant that fits the usual inclusion criteria into a trial, we risk in this setting diluting an effect from a drug that actually works, and in the sense that we might include a heterogeneous population that is too heterogeneous. Here we would select a population that we're more certain would respond to the drug. And so if the drug is effective, at least in a subpopulation, then it's identified early, and we ensure that drugs that are efficacious are brought to market earlier so that they can benefit patients earlier. So that's the first role for personalizing treatment recommendations in the clinical trial setting for predictive enrichment. The second is a little bit more obvious in the sense that if we have a model that can predict whether a person would respond well to a treatment, we can use this in the clinic as a physician to provide a better recommendation to a patient. If we know, well, yeah, you're going to respond better to this treatment or to that treatment, then we can recommend that treatment with more confidence. And that's exactly what this type of model that I'm presenting can be used for.